is Jessica Christie, and this is Blake, and he volunteered to be my patient for my head-to-toe assessment for Maryville University. Before entering the room, I had Blake empty his bladder and change into comfortable clothes. We obtained a full set of vital signs, got his height and weight, and tested his distance vision using the Snellen chart and his near vision using the Rosenbaum chart. Upon entering the room, I did hand hygiene, and we are now ready to begin. First, I will start with the general inspection of the head and the face. The head is rounded, symmetric, and normal cephalic. The external characteristics, such as the eyes and the ears, are symmetrical. Palpating the head, palpating for tenderness, masses, or lesions, and then the scalp moves freely and is very mobile. Next, I will palpate the facial bones, making sure there's no masses or tenderness. I will palpate the frontal sinuses and the maxillary sinuses. Palpate the temporomandibular joint, having the patient open and close his mouth. Noting for any popping, clicking, or pain, and none was present. Next, I will have him raise his eyebrows, squeeze his eyes shut, puff his cheeks out, stick out your tongue, and smile. These are all noting cranial nerve function. Next, looking at the eyebrows, the hair is distributed evenly and going towards the outer canthus. Next, I will palpate the lacrimal apparatus and look into the eyes at the sclera and conjunctiva. The sclera is white and the conjunctiva is pink and moist. Next, I will have the patient pick a spot on the wall and cover his right eye. Good. And your left eye? Good. Noting for any nystagmus or extraocular movement. Next, I will have my patient look at my pen light and follow it with just your eyes. Good. Next, I will look into the eye, looking for pupillary constriction. Direct, convergent, direct, concentric. Next, I will look into my patient's eye. Okay, Blake, I'll have you pick a point on the wall and just look at it. Good. And the other eye. Good. Noting red reflexes in the blood vessels in both eyes. Next, moving on to the nose, it is midline. Looking into the nose, looking at the mucosa and the turbinates, they are both pink and moist, and the hair is evenly distributed. Next, I will have the patient hold one side of their nose and blow in and out. Good. And your other side? Good. Both sides of the nose are painted. Next, looking at the ears, they are symmetrically placed. Palpating the ears, the auricles, they are non-tender. Next, I will look into the ears. Noticing that the tympanic membranes are pearly gray and the auditory canals are clear. Next, moving on to the mouth, noticing the lips are not cracked or there are no fissures. I will have the patient open their mouth and look at the hard palate and the soft palate, the uvula, the tonsils, the tongue, underneath the tongue, the sides of the cheek, the using a tongue depressor. And then the other side, and looking at the teeth and their color and characteristics. I will also have the patient say ah. And test his gag reflex. Good. Also on the face, I will have Blake close his eyes and tell me where he feels the sensation.
Forehead. Cheek. Chin. Cheek. Chin. Forehead.
Good. Next, we will check your hearing. So I'm going to tap this tuning fork, and I'm going to place it on the top of your head. I want you to tell me if you hear it in your right ear, your left ear, or both ears.
Both.
Okay, I'm going to tap it again and place it behind your ear, and I want you to tell me when you no longer hear it.
Okay.
Now I'm going to place it in front of your ear, and I want you to tell me when you no longer can hear it.
Okay.
Good. Air conduction should be twice as long as bone conduction. Next, I will inspect the patient's neck, noticing for the skin color and noticing for any lymph nodes or nodules. So first, I will palpate the lymph nodes, the preauricular, the postauricular, the tonsil, the submandibular, the submental, the cervical, the post-cervical, the deep cervical, the supraclavicular, and axillary. Good. I will palpate the trachea. It is midline. I will have the patient swallow to feel that the thyroid is smooth and moves freely. Next, I will look at the patient's upper extremities. They are noticing that they are pink, warm, and dry. Feeling for temperature, making sure that they are warm. The hair distribution is equal. I will palpate brachial pulses, which are 2+ bilaterally, and radial pulses, which are 2+ bilaterally. I'll have you put your arm straight out, press up, press down, good, straight out, press up, and down, good. This is testing cranial nerve function and range of motion. Next, I will inspect the chest, watching for any obvious pulsations. I will palpate the chest, palpating for any masses or nodes or lesions. Next, I will percuss. And have you lift your arms? Good. Can I have you say 99?
99. 99. 99. 99.
Good. Now I will listen to your breath sounds. Every time I move the stethoscope, will you take a deep breath? Good. Now I will move my stethoscope to the bell and listen for the carotid arteries one at a time. Then have you take a deep breath in and hold it. And breathe. And then another deep breath. And good. Good. I also palpate the carotid arteries one at a time. and they are both 2+ bilaterally. Next, I will palpate the pericardium, making sure that there are no heaves, thrills, or lifts, and palpate the left apical pulse. Next, I will listen to the heart sounds. The aortic, the pulmonic, Herb's point, tricuspid, and mitral. Good. Can I have you turn around so I can inspect your back? Good. Inspecting the back, and then I will palpate the back, making sure that there is no tenderness again. I will percuss. Good. I will have you just bend slightly forward. Good. I'm going to have you take a deep breath in and hold it. Good. Listening for the changing sound, you can breathe. And now I want you to take a couple deep breaths out and then hold it out. Good. And palpate up until you hear the changing sound and measure the distance between the 2 points. Next, I will have you say 99 again.
99, 99, 99, 99.
Good. I'm going to percuss the coastal vertebral angle. This should elicit no pain. Can I have you take one more deep breath? Good. Noticing that I have symmetrical expansion up. Next, I'm going to listen to your breath sounds again on your back. Good. Can I have you raise your arms up so I can listen to your side? Okay, I will have you lay down. First, I will start by inspecting the abdomen, making sure that there are no obvious pulsations or movement. Then I will auscultate in all 4 quadrants. Sometimes you'll have to listen 2 to 5 minutes to hear any vowel sounds. Next, I will start with some light palpation. Followed by some deep palpation. Next, I will percuss the liver borders. And the spleen. Next, I will palpate the liver borders. And I will attempt to palpate the spleen, but that should not be possible. I will palpate the right kidney and the left kidney. Next, I'm going to listen for the aorta with the bell of my stethoscope. The renal arteries, the iliac, the femoral. I will palpate for the aorta. Good. Can I have you lift your head and I will feel your abdominal muscles? Good. I will have you sit up. Good. Now we will look at the lower extremities, looking at the muscle mass, the hair distribution. I will feel for warmth. I will feel for the popliteal pulses. The posterior tibialis. And the dorsalis pedis. I will have you try to push against my hands. Good. And there you go. And your foot. Push down. Good. And your other one push down. Good. Next I will be checking your reflexes. I will start with the brachial. Have your arm rest in my arm, completely relaxed. Good. Your other arm. Your knee reflex. Your other knee. And your Achilles. Okay, next I will have you stand up to inspect your back. I will inspect the spine to make sure it is midline and there are no obvious deformities. I will palpate the cervical spine, the thoracic spine, and the lumbar spine. I will have you bend over slightly, checking the curvature of the spine, making sure there is no kyphosis or scoliosis. And this concludes my head to toe assessment.